So today we are going to be talking about abortion, the rights we have, the access we have, and some intersectionality around abortion. So what is abortion? Abortion is the termination of a pregnancy. There's a very, very large variety of types of abortion that someone may receive, and there's a lot of different reasons as to why someone may receive an abortion. Some of the common types of abortion that we're going to be talking about today are medical, surgical, induction, and back alley abortions. So, why abortion? There's a lot of controversy around the topic of abortion, and a lot of people don't understand why someone actually may be getting an abortion. As I say right here, there are a wide variety of reasons a person may choose to receive an abortion, and some of these reasons include potential health risks during pregnancy, so effects that could potentially harm the mom or transgender male or non-binary individual. It could potentially harm them or kill them in the long run. Fetal abnormalities, something is not right with the baby, and possibly the baby might even die. Problems within a relationship. If you get pregnant and you're in a relationship and there's no support there, there's fighting all the time, abuse, sexual abuse, physical abuse, emotional abuse. It may drive someone to feel as though that they don't want to raise a child in that environment. Gender dysphoria. This can happen, like I said, in transgender males or non-binary people. They just feel as though they aren't supposed to be holding a baby. They feel deep inside that they should not be carrying to term. They shouldn't be pregnant, They feel as though inside they are male or they don't identify with any gender, and it causes problems within their own mental health to see their stomach growing and understand that they are going to have to be a parent one day. Another reason that people may get an abortion is social stigma. A lot of people may be subject to problems within their life, and because of social media and the people around them, they may feel as though that they are not fit to take care of a baby, and the financial and emotional baggage that comes with it may not be worth it to a person. Like I kind of explained up above, some lack of support. You don't have any support, you don't have financial stability, you don't have emotional stability, you don't have family around you, you don't have a partner to help you, and it just all becomes way too overwhelming, and you don't want to bring a child into the world when they won't even have support, just like how another person may not have support. Rape or sexual assault victims, they may get an abortion just because the emotional trauma that they have faced, they can't handle knowing that baby is coming from the person that did this to them. And lack of gender affirming healthcare. A lot of people, like transgender, non-binary people, may choose to just get an abortion because the healthcare that they receive is just not what they need it to be. It makes them fearful, it makes them uncomfortable, it gives them more gender dysphoria than they may already be feeling, and they just don't want to go through that time through a pregnancy to possibly give them even more gender dysphoria or feelings of fear and feel scared. So these are only a few of the reasons that someone may consider abortion, but it's important for people to understand the resources that they actually have for these specific types of situations. So here are some of the types of abortion. The first one is a medical abortion. This method of abortion is a pill taken to terminate pregnancy up to 10 weeks of pregnancy. People may choose this method if they feel more vulnerable to stigma, such as, like I was saying, transgender, non-binary people. They can take this in the comfort of their own home and not feel judged by healthcare. It kind of makes them feel as though they have more authority over their own reproductive rights. So this is a very good method for people that feel that social stigma and don't want to make a big deal about what's going on, and it's early enough for them to actually be able to do this. Surgical abortion it can include a wide variety of different procedures, and it can be done through the second trimester of pregnancy. So some of these are suction abortion, which is basically just it's exactly what it sounds like. Suction is used to remove the pregnancy directly from the uterus. And then there's D&E, or dilation and evacuation, which basically the cervix is dilated open, and then suction is used to remove that pregnancy tissue from the cervix. And this, like I said, happens in the second trimester of pregnancy. There's also induction abortion. This is used usually in later pregnancies, and it's where a medication is given to induce labor. This may be done because of fetal abnormalities or death of the fetus. It could also be due to health complications of the mother or non-viable pregnancies. It can be incredibly emotionally distressful for the person going through this abortion, as most of the times they will see their fetus and see what they have been growing inside of them. It can cause additional stress to transgender and non-binary individuals, as it can cause extreme gender dysphoria and feelings of disconnect from their body, which can just cause, even like I said, more gender dysphoria, and cause mental and emotional distress. So what is back alley abortion? Back alley abortions are illegal abortion procedures performed usually outside of a medical setting. They're very secretive most of the time because they are illegal and people don't want to get caught, as they can get fined, they can get imprisoned. Lots of consequences come from back alley abortions. Back alley abortions are also very unsanitary and very unsterile. So in other words, they're very, very dangerous. The likelihood of death due to complications or limited aftercare is very high. Because these people are getting this done illegally, they don't want to go and get that aftercare that might be necessary, which can cause infections, internal bleeding, psychological and emotional distress, which are just a few of the outcomes of illegal abortions. And a lot of the reasons a person may resort to a back alley or illegal abortion is because of the social stigma behind actually getting an abortion, financial issues, or some of the restrictive laws that we already have on abortion in certain states. So, what are some of the social stigmas of abortion? First, we have the perception versus reality. So, the perception of abortion, as you stated in your lecture, is very different to the reality of abortion. It's thought that abortion is not really that common and only certain people can get abortions, but that's just not true. It's estimated that every 1 in 5 pregnancies will end in abortion, which is up to 44 million abortions a year, which is a lot more than I think what people understand. Some of the other social stigma a person may face is legal barriers. Women seeking abortion may face waiting periods. They may have required ultrasounds, restrictive laws allowing abortion, like we talked about. There's sexuality and gender bias. Transgender men and those who identify as non-binary may face a stigma due to the traditional gender roles of the world. It may be expected for them to still carry their pregnancy, even though they might not feel as though they can, mentally, emotionally, physically. And a lot of healthcare professionals may not be trained in gender-affirming care, which may make it an even bigger issue for people going through, transgender, non-binary people going through a pregnancy and wanting an abortion. It may be even harder for them to find this care, just because not a lot of practices are practicing that gender-affirming care, which is really important for these people to feel as though they have the same access as every other person that is seeking abortion. It's misinformation. Another thing that has formed a negative social stigma is media. It's caused a lot of misinformation to be spread, and it has created a very negative outlook on the topic of abortion. This in turn makes people feel scared or unsupported in their decision to get an abortion, which is just really sad because a lot of these people are not getting these abortions due to people around them and not for their own personal feelings. People feel a sense of shame and guilt for their own personal decision due to a wide variety of external factors. It's important to have thoughtful conversations about this subject and protect reproductive rights. The reason someone gets an abortion shouldn't be important rather than the support they receive during this time. Their own personal reason should not affect the way that someone sees them. They're doing it for themselves, and it shouldn't affect anyone but them. So some of the resources that someone going through abortion may seek is Planned Parenthood, very common, very well known. They offer services such as safe and confidential medical and surgical abortions. They also have resources relating to counseling on reproductive health, gender identity through this time, as well as Planned Parenthood practices gender-affirming healthcare, and they want to make it an inclusive environment for anyone going through this time to be able to come into and feel safe. The National Abortion Federation, or the NAF, offers safe abortions for anyone that may need them, and they're inclusive to all as well, much like Planned Parenthood. They also have a hotline for those that need to find a provider that's near them, those seeking an abortion that need to find providers that are close to them. Some of the resources that transgender or non-binary people have is the Pro-Choice organization. This program allows transgender men and non-binary individuals resources for abortions. They also allow for more diversity and inclusive care when it comes to abortion. So they are trying to get more inclusivity and more gender-affirming care out there into the world so that these people do have the resources that they need. And also gender equity and reproductive health organizations. They also are filled with policies and resources regarding the reproductive rights of transgender and non-binary individuals. So when people need to come back to those, they're filled with research and education and policies that these people have. And it allows for safe abortion for all people, regardless of gender or sexuality. So I have a couple facts here about abortion. There's less than a 0.5% chance a safe or legal abortion will have complications. So finding those resources and actually not doing a back alley abortion, you are very, 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 very low risk to having any sort of complications. In-clinic abortions have a success rate of 99%. So only 1% of people are not having successful abortions, which is a really low percentage. Abortion is not linked to any other serious health complications or infertility. This is a myth that has been debunked. A lot of people thought that it could cause cancer, like breast cancer, infertility, but this is not related at all. They do not have any links. A myth about medical abortion is that it is extremely painful. While it can be painful because you will be experiencing cramping and bleeding, that's normal, but those should subside within 24 to 48 hours. And if you're having extreme pain, always consult a doctor or your provider. Let them know what you're feeling. But a lot of women say that they were very well prepared and talked through the feelings that they would feel through this, and they felt even more prepared for that feeling as they were going through it. Research has also shown the use of testosterone or other hormone replacement increases the risk of miscarriage or unplanned abortions. So transgender men that may have been on testosterone may be at a higher risk for miscarriages or later on induced abortions. Not to say that this is everyone, it's just a little bit of a higher risk. So something to think about for those that are going through this time. So abortion access and proper resources are so important for everyone going through this time. You never know what someone is actually going through, so that allowing someone to have an open conversation with you, allow someone to have the resources that they need through this time, it's very important, and it's very important for people to feel supported. This is a very tough time that someone may be going through, and the least you could do is give them a shoulder to cry on or lean on when they are having a tough time. Thank you for watching. I hope you enjoyed my presentation on abortion, and I hope you learned a little bit more.